We provide case management and contact follow-up for the cases specifically here for COVID and other vaccine preventable diseases in our Fraser region. So case management looks like contacting a case, doing an interview with them to kind of figure out where they could have gotten COVID from in the community, and where they could have spread it as well, and keep checking in on them to see how they're doing health-wise. Sometimes there are worries that come up during the conversations. We work with them to figure out how can they effectively isolate in their household while still keeping up with their lives. And then we follow up with their contacts to ensure that they're isolating if they have been deemed to have been exposed for the appropriate amount of time. And we talk about how to do that properly, especially if you live with other people, because there are different levels of health literacy, different levels of understanding, and different people have different worries. So it's working with each group, whether that's cases or contacts, to explain what public health would like them to do and what are some obstacles that might come up that might hamper you from isolating properly, and we kind of problem solve through that with the supports that we have and the education that we have so that people are able to stay safe at home and keep their community safe as well. So a typical phone call is I'll call the case, introduce myself, say that I'm calling from public health, following up with their swab results. Sometimes we are the people that are letting them know that it's positive, so we start out with that, and then I usually talk to people about how are they feeling that time, like, because that result can be kind of stressful and anxiety inducing for some people. So I usually start my conversations with how are you feeling right now, what's going on, and then from there we work through, okay, so anytime somebody tests positive, public health follows up to kind of figure out where you could have gotten COVID and where you could have transmitted. I'm going to ask you a series of questions, and this is the purpose of this is the reason why I'm asking these questions. Here is how the information is going to be used. It's kind of like a microscopic exam of all the activities a person does during their infectious period, how they get places, what they do when they first get there. Are they masking? Are they not masking? That kind of thing in each setting. So it's at work, at home, if they've been to any congregate settings like schools or places of worship. So Fraser Health is has some new opportunities for contact tracers as well as contact tracing aids to kind of help support the need in this pandemic going forward. So it helps being curious, because you're a bit of a detective, especially when you're dealing with cases, trying to figure out where they might have gotten it, trying to figure out where they could have passed it on, and if you're having some obstacles during that conversation, trying to figure out how can I rephrase this or redirect this conversation so that I'm able to get some of the information that I need. And it's also really helpful to be flexible and open to change. Things are changing every day, our policies are changing every day, the recommendations are changing every day. So kind of being flexible, thinking that, okay, today might not look like tomorrow exactly, but there's somewhere that I can find the information that I need. Responding to this pandemic, it's a partnership between the healthcare system and the community. It's based on trust, so we trust that the community will listen to the recommendations from public health officials. And the community trusts that we will follow up with them if they have been exposed and provide any of the follow-up that we need. So it's that happy relationship that's going to be really important in how we continue to respond in the pandemic. And that's something that's always on my mind.